Hello. Your doctor has recommended that you have chemotherapy as part of your cancer treatment. Chemotherapy is treatment with medicines or drugs that destroy cancer cells. There are lots of different types of chemotherapy medicines, and you may receive one chemotherapy drug or a combination of drugs. This is because your chemotherapy will be individually tailored to you and your cancer. Chemotherapy medicines may come as tablets that you take every day at home, or as a solution that has to be given via a drip into a blood vessel, known as intravenous chemotherapy. If you and your cancer specialist, known as an oncologist, have decided that you need to have chemotherapy to treat your cancer, your oncology team will create your own personalised chemotherapy plan. You'll be told how and when you will receive your treatment. Chemotherapy is given in cycles. This means that you will receive treatment regularly for a period of time, followed by a rest period to allow your body's own healthy cells to recover. You will then start the next cycle of chemotherapy. Depending on your treatment plan, you will have several cycles of chemotherapy. If you are having chemotherapy in a tablet form, you may be able to take this at home. Routine blood tests at your GP surgery or the cancer unit will be arranged so that we can monitor you for any side effects. However, most chemotherapy is given in the cancer unit by our trained chemotherapy nurses. Although depending on availability, it may be given in a mobile chemotherapy van that travels around the area. In a few cases, chemotherapy may need to be given as an inpatient. If you are having intravenous treatment, a nurse will insert a plastic tube called a cannula into a vein in your hand or forearm using a small needle. Sometimes a more permanent cannula, such as a PICC line or a Hickman line, will be inserted. This can stay in for several weeks or months and means you don't have to have a new cannula each time. Once your cannula is in place, the chemotherapy and anti-sickness medicine can be given. This usually takes several hours as the medicine needs to be given slowly. You will remain in the unit during this time, so we recommend that you bring somebody or something along with you to keep you occupied, such as a book or a tablet. When you come to the cancer unit for review before your next chemotherapy session, you will have blood tests to check your blood count, and we'll see a doctor to make sure you are well enough to receive further chemotherapy. Some people have very few side effects during their chemotherapy treatment, whilst others struggle a bit more. Most side effects are temporary and will gradually disappear once your treatment finishes. We are here to support you and help to minimise the side effects as much as possible. The most serious side effect of chemotherapy is a drop in the number of cells in your blood, which leaves you at risk of infections or bleeding. For many patients, their biggest fear is losing their hair. However, this only happens with some types of chemotherapy and usually starts a few weeks after chemotherapy begins. We can support you with cold caps, which help to reduce hair loss, and wig services. Other common side effects are nausea, poor appetite, fatigue, a change in your bowel habit, pins and needles in hands and feet, and a sore mouth. We can prescribe medicines to reduce these symptoms, such as anti-sickness drugs. If you have any questions about chemotherapy, please speak to your oncologist or cancer nurse specialist. We're here to support you throughout your treatment.